welcome to I say Dr. Mitchell. Welcome to Coffee with Joy show. So excited. You see people, I'm already just trying to get into the conversation as we're talking about Black maternal health. And of course, this is for all women. We need you all to hear. I have the expert, the woman of the hour, of the minute of the show, who's going to share us some great information on how to go about getting a better health if you are especially a Black woman or just women in general, as we conclude Women's Month, right? So after these messages, we're going to talk to my guest, Dr. Mitchell, and hear some great information about Black women's health. Advertise your business on our podcast. Connect with us, the Coffee with Joy Talk Show podcast, and let's grow together. Email us, and we welcome to Coffee with Joy. So I'm gonna bring my guest on, Dr. Mitchell. Hey, Dr. Mitchell, how are you?
I'm great. I'm so happy to see you. Thank you for having me here.
Of course, thank you for accepting. So right before we get in, can you tell people a little bit about yourself, and then we're going to jump right into our conversation.
Okay, so my name is Dr. Rashonda Mitchell. I'm actually a country girl from Tennessee, just trying to found my way to the big city. And I am a maternal fetal medicine physician. So a lot of people refer to that as a high risk doctor. But basically, I like to care for moms who have, and their babies, who may have a few complications or a little bit of difficulty transitioning into life. So what that means is I take care of moms with either chronic diseases, some newly diagnosed diseases, and or the fetus or baby itself while in utero if the baby is diagnosed with an abnormalities. And I just love what I do.
Wow, that's amazing. So we're going to jump right into the conversation. Of course, Black women's maternal health.
Absolutely.
What is the primary issue that you see amongst Black women? And then, what in your field, what is the number one thing that you see that's a primary issue? Of course, we know there's a laundry list, right? Yeah. But what is the primary issue that you see amongst Black women as they're coming in trying to find health as they, either their first child, second child, so forth?
Well, the funny thing is a lot of people will think it has more to do with a medical condition, but I really think a lot of what we are missing in our communities as Black women is really just that knowledge of what it means to carry a child, to be pregnant, and to have health during that time, as well as like what to do with the child afterwards. So that concept of mothering, that concept of nurturing, because I see that absent in a lot of the women that we care for. It's just the idea of the term, oh, I'm pregnant, but not the idea of that I am carrying a child. I am carrying the next generation. So it's really the mindset. And I think if we start working from that baseline, I think the health part will follow.
Wow. And in that, what are some key takeaways that because I think that is so vital, because like you said, I don't think a lot of people think about it. We just think about the 9 months and then, hey, you're on your own. But now the child is here, and women deal with postpartum and so many other underlying issues that occur, and we have yet to address that or even brought it up. My goodness, that's amazing.
Yeah. So let's talk about it. So let's first talk about like what it is to be pregnant. So pregnancy has an effect on your body just for carrying a child. You are creating and carrying that life, sustaining it and supporting it. And it is pretty harsh on the body, believe it or not. It is what we like to say in our field, it is kind of like a catabolic process where you are utilizing a lot of energy to help sustain the life of this new person that you are about to birth, right? And so in that, it can be a little bit, difficult with some moms if you start out with medical conditions. So you have to say, what does this pregnancy mean for me just in a health and in a health state? But also, what does it mean if I do have a chronic condition? Is it going to make it worse? Is it going to make it better? And how am I going to manage it? And then also manage it after the child, because we want to be healthy enough to care for this child afterwards. Okay. And so now the science is supporting, right? The science is supporting that what happens in utero to the child affects its life
Mhm.
outside. And so that's something that they're really starting to study, even at the NIH, called epigenetics. So it's what does the environment while the child in utero, how does it affect their their long-term health? So when we start thinking about this as generational health, then we have to really start considering what is our health while we're pregnant, before we're pregnant, while we're pregnant, and after we're pregnant to care for the child. We know the statistics, right? We know that Black women have a higher rate of morbidity and mortality. So you're going to say, well, what is morbidity? Morbidity is sickness, is illness, and mortality is exactly what it says, it's death. Okay. So we have higher rates of that. And you want to say, well, what contributes to that? Well, a lot of research over the last couple of years have given us like answers as to what it is, what contributes. And so we all know that, to me, it is multifactorial. Okay. Yes, systemic racism sits at the root of some of it, right?
Mhm.
Is another layer that adds to it. Broken systems and community add to the next level of it. And so I also think there is a knowledge deficit on our parts as well. And so I think that we have to work on all of those things to really get at the crux of the issue. So yes, we do need our policymakers. We do
Yeah.
need our community health workers going in and pushing for policy and change to help our communities and our mothers have better lives. We do
Mhm.
need our physicians to be culturally sensitive and be able to provide care that is culturally appropriate, but also how can I say it, sensitive to different cultures. Okay.
Yeah.
I have the privilege of caring for so many women, types of women at Howard University. And I mean, that range from moms who make no money to moms who make a lot of money. And when I say that, it's not just about class, it's
Yeah.
also about culture. Because I could literally use an interpreter, speak French, Urdu, Spanish, um, Tigrinya, Amharic, all in one day.
Mm.
And so culturally, what does that mean? What does pregnancy mean in different cultures? How are women expected to be treated, during that process? What is a culturally appropriate for me to say and do during
Mm.
times and offer them during those times? So I think once we open and broaden our minds on what it means to, one, be healthy, and to also carry a child, and also birth the
Yeah.
next generation, I think we'll start to look at it a little different.
Wow, that is a mouthful because again, that's like taking the course graphic organizer, the double bubble, and just keep dialing out in my head. I'm like, wow, it just gets deeper and deeper. Oh
Um,
my goodness, because words can mean different in different cultures. So you may, and like you say, you saying something that may be insensitive to the other, and you're not really meaning that. It's
yep.
like, wow, and I'm just sitting here like at all.
Mhm,
Like,
mhm.
okay, my little piece of the pie just and of course, I mean, I am at all like,
Uh-huh.
wow.
And I think we have to think about that, because
Yeah.
when we say Black maternal health, that includes other people from different diasporas. Okay,
Mhm.
so that doesn't just mean like American
Yeah.
and Black. This could also mean we take care of people from Somalia. We take care of people from Ethiopia and Eritrea. We take care of people from Nigeria. We take care of people. And culturally, what does it mean? What is it? What is appropriate? What is that sensitivity? What are they expecting from us as a provider when we provide those services? And I think that is so important, to consider, and not just lump Black maternal health into one space.
Wow. And that's exactly because I'm at faults, lump. Because again, when you think of black woman, you just think of black woman. I never gave it a thought to, put them in their sub areas, right? It's
Mhm.
just black woman, but now it's like, wow, Joy, there's and
Because
you know it. It's not to say it's not you don't know, you know it, but when it comes, you're like, wow, it really broadened the horizon, like, okay, not only here, but it's here and it's different. Oh my
oh,
goodness.
yeah, and I'm thinking of, like, and I'll give a prime example.
Okay.
A mom who is from a Muslim country, she is Black,
Mhm.
and she may have different expectations as to what it is like to be in labor during that time, because culturally it may mean something different to her. And when you ask her, would you like a male provider and or not, what does that mean to her? Is it respectful for you to see her without her hijab and stuff like that? Like, all of those things matter. And when you have people from different cultures, their education on the level of sex education, pregnancy education, health education may be at a different level, because culturally they may not talk about these things. They may not have access to as much information as we have.
Yeah.
So there are some things that some moms just don't know or understand, and they can't manage it because they don't know about it. They weren't taught about it. They didn't understand that this could be a risk um, in it, because culturally they didn't know. So yeah, we might have a bad outcome. This is because this mom's knowledge base may not be at a level for her to comprehend what is really going on, maybe in an emergent situation.
Mhm.
Mhm.
Wow. I mean, that I'm just like at it's just such a mouthful, right? And it really have you thinking. Like, this is deep. Like, the rabbit hole just keeps getting deeper and deeper. But you're the expert, but from the person standing looking at the hole, you're like, wow. I thought the hole was just probably 2 feet, but really it gets below 6 feet and just gets deeper and it widens, right? So
Mhm.
what is like the so like how do you curve that? Like how do you try to, I guess it's kind of hard to ask the question, but I'm just asking anyway, and I guess you will fix it. Where how do you fix that when you're dealing with this woman, but
Mhm.
this woman's from different areas? Like, and how do you make sure everyone feel comfortable from a health as a health provider,
Mhm.
making sure that they feel comfortable. They already know they probably coming in with the situation. How do
Mhm.
you fix that issue or try to, not to say massage it or try to make it feel better, but try to give the mother, because like you stated, she already is going through so much. The body is transforming, and knowing that I'm bringing life to this world, so it's
Mhm.
already having me thinking one way. So how do you go about fixing that, or try to place that in a way where the mother feels comfortable?
Well, I think one of the biggest things that we can do is listen. Listen to moms and meet them where they are. Okay. And I think it's hard to do if you're not culturally sensitive. And we know providers, and I'm going to say providers because it could be a midwife, it could be a physician assistant, it could be a physician. We can be paternalistic because we have this training. And yes, there is a level of knowledge that we do have, and it should be respected. But I like to meet patients where they are and
Mhm.
have them understand as much as I can what that means and what I'm trying to explain to them. And and ironically, one of the best things, the most important things that I see is that when you meet them where they at, whether they really understand it or not, they say, whatever you say or whatever you think is best, I will do. And
Mhm.
they will relent, but they have to know that you care about and you're considering how
Yeah.
they feel where they are, and what is important to them. And for moms, most moms, I, it's make sure that my baby is okay.
Yeah.
Whatever you recommend to do that. But I am honest. I like to provide a lot of education
Yeah.
in situations where I have the ability. Sometimes in emergent situations, we don't have that opportunity to say, break it down to everybody. We have to make a decision quick
Mhm.
because we're in that emergent situation. But I think the first thing we have to do is acknowledge our moms and how they feel. We
Yeah.
need to listen to them. If they say it hurts, it hurts. If
Mhm.
if they say they are uncomfortable, they are uncomfortable. And then if we feel that it is irrational, try to understand why they feel the way that they feel.
Mhm.
It may not be a rational reason. And sometimes, guess what? You're not going to agree and you're
Yeah.
not going to rationalize and make it make sense to everybody. But for the
Yeah.
most part, most moms you can do. So I think just as a physician, I would like to, and as a leader of my team, I like to meet moms where they are. And I like to see, what is this? What do you understand? How can I help you understand this better so that we can make the best decision for both you and the baby? Because sometimes, guess what? We forget about mom.
Yeah,
All we think about is the baby. What's
yeah,
best for the baby? But you got to say, hey, mom, how are you feeling?
yeah, yeah.
What does this mean to you? You
Mhm.
know, and that's literally what a lot of women want. And I think we have this culture around pregnancy now where it's all about the baby. And
Yeah,
we throw
yeah,
the mom out afterwards. How was
yeah.
the mom? Do we, at a baby shower? It's a baby shower. We get the
Mhm.
baby something, but what about mom?
Yeah,
Mom, because mom has to eventually care for this baby. And that is the whole point of the pregnancy. And this is the way I think of it, because I
yeah.
am maternal fetal. I do care about the fetus,
Mhm.
but I know that if I take care of mom, mom is going to take care of the baby and do
You're right.
everything it needs in that moment. So my primary focus is mom, making sure that mom is healthy, is happy, not just, happy and healthy, but that she understands. And I know that at the end of the day, I'm doing what's best for ultimately the baby.
Wow. Now that the baby's here, what like no, not I didn't want to ask that question yet. Now,
Uh-huh.
what is if a patient is coming to you, what is something that they should what do you recommend if they unable to see a physician
Mhm.
or provider? What are some strategies or things they should do if they're feeling some type of way or they're unable? Because we know quite a few people, many women probably not married, or they may not have their significant other and they don't know how to explain or like what are some tactics or techniques or strategies that you recommend if someone is willing to get pregnant or they're probably in their first trimester? What are some things that you can suggest to them before even things start to turn? Because again, anything can happen, right? But
Yes.
this is just a hypothetical situation,
Right.
right? First semester, everything's calm, I guess, but they may not have a significant other. Like, what are some things they should do before if this their first time coming to see you or talking to you if there is something that they feel is out of order?
One of the first things I like to say is find a physician that you can have a good relationship with. Now, you don't have to be girlfriends. You don't have to kiki and have a good, it's great if you find somebody like that, but you need to find somebody that one is going to listen to you, that is going to, one that is going to support you through this. And one that you feel open enough with, that you can trust them and be honest with them and not feel like you're being judged. Because in that relationship, when it becomes symbiotic, you're going to be able to provide me with real, honest answers about how you feel. And I'm going to be able to meet you and we can discuss how to manage whatever it is. Prime example, you're honest with me. And I know this is going to sound far fetched, but it is real.
Yeah.
Doc, I do crack.
Mm.
Be honest with me. I don't care. So, how am I going to help you manage this problem in this pregnancy? I'm not here to judge you. How are we going to get through this so that both you and the baby will be happy on the other side? I want you to be able to feel that comfortable with me, that we can talk about these things, and so that I can help you, because it's that fear of not being able to be honest with your doctor about what's going on that can sometimes prohibit you from saying some things that may save your life or your baby's life. So that's the first thing, is find a physician that you can get along with and you can trust and you feel like really takes your feelings and who you are and your health serious, not just somebody that you're just seeing because that's who somebody referred me to. I
Right.
tell people all the time, if you don't like me, please go find you another physician in the nicest way. Like, I
Yeah.
want you to be able to have a relationship that is great with your physician, so that we can have the best outcomes. I want the best outcomes, and I know
Yeah.
you want the best outcomes. So let's work on something that where we can do that. And so I'm completely try to be as completely honest and transparent with my patients as I can. The second thing is take somebody with you. We
Yeah.
know that 50% of women are not in a committed relationship or married when they become pregnant. So in that event, make sure that you have somebody that's going to be by your side, that can be an advocate, but also level-headed at the same time.
Yeah.
And somebody that is going to support you in that moment. So that could be a family member, a best friend, a doula.
Yeah.
And if you start out with them in the beginning, you can kind of develop that relationship as you go along, as well as like your significant other. I know when I had my son, I had to
Mhm.
talk with my husband.
Yeah.
If I am unable to advocate for myself, I want you to do X, Y, and Z.
Yeah.
That is a real conversation I had, because we know the rates of maternal morbidity and mortality for Black women, whether you have an education or not,
Yeah.
are higher. So in that event, I needed my husband to understand, I need you to keep a level head. I need you
Mhm.
to be able to communicate with them what my wishes are, and you write everything down if you
Mm.
feel uncomfortable. So you need to have that support person that's going to walk with you through the pregnancy, whomever that is, your partner, your family member, your doula, your support person. That is what I would. And start it as early as possible.
Yeah.
Those would be the first thing. Read, learn about pregnancy. Read what it means to be pregnant. How is this going to affect my life? How
Yeah.
is it going to affect, I don't know, like my weight? How is
Mhm.
this going to affect my hair? A lot of people don't know about postpartum hair shedding. Like, read about this thing. These things are happening to you, inside of you. So learn as much as you can. I feel like you're in an incubator, and this is the best time for you to just kind of sit and learn as much as you can. So those are my top three things: is find a great physician, have somebody that can advocate for you, and learn as much as you possibly can about pregnancy and what it means to be pregnant. And
Yeah.
if you have medical conditions, what does that mean for the medical condition? Because we like to look at it this way: what effect will the pregnancy have on my body and my medical and the medical condition? But then it is also, what effect will my body have on this pregnancy? Okay.
Mm.
And so you have to look at it both ways, and how you can be as healthy as you possibly can during the process. Some stuff you can't avoid.
Yeah. And see, now I wanted to make sure that the expert said that, right? As much as someone may say, okay, yeah, I got that. But it may sound like, oh, that's easy. But listening to an expert actually saying it, a doctor saying
Mhm.
it, really get the point across to understand that this is your life. Anything could go left.
Yeah.
And to have those hardcore conversation with that one or two or your community or your support system is very vital, you
Yeah.
know. And I know you probably seen, and this is just me watching. I guess I watched too much Tubi or something. I don't know. Where the and I know it's fiction, right? But some of this fiction is coming with the nonfiction, right? Where the woman is
Exactly.
healthy, next
Hmm.
thing you know, she dies on the table.
Yep.
Anything could go wrong,
Mhm.
and they got it from somewhere. So you want to make sure you have that, and no one's exempt. You
Mhm.
know, making sure that you take your life serious. And I think a lot of women just say, "Hey," and they think just because I'm young, nothing's gonna happen, right? Or, "Hey, I'm 40, I'm up here trying to read." Anything could go wrong. Now, do you see a situation, the age situation like that,
Yes.
where young women, at church, some of my pastors said that when you're 0 to 20, you're in the first quarter, you're 20 to 40, you're in your second quarter. So I was like, oh, okay. And then you're 41 up to 60, you're in your third quarter. Now, do you find the issues in the age where some women feel like, hey, I'm young, I'm healthy, I could do this, I could pop it out? Do you find those situations and then life takes a turn for
Yeah.
when they get there?
Absolutely. Absolutely. One of my favorites is, oh my God, this is my first baby. They're young. So they really haven't experienced life, or probably had a surgery by that time. So they don't really know what real pain is. And they be like, I'm not getting the epidural. I'm good. I'm gonna do this natural. Let them contractions kick in, okay? then life really hits you
You're
because
right.
you have no clue about what it means to have and birth this baby, and your body is physically changing. Okay, I'm going to give you a couple of stats. I don't like to talk in numbers, but your blood volume expands by 50%. So that means if you have 6 liters of blood, now when you're pregnant, your heart is pumping 9 liters of blood every minute. Okay, so it is pumping. It is, your heart is working harder. Okay, so your heart is working harder. You've gained weight. You're short of breath because your lung capacity, it doesn't really change, but you do increase your respiration rate when you are pregnant. That's just a natural response. The second thing is that we know that during delivery, a normal blood loss is like 500 cc's. So some people say, well, how much is that? It's about a liter. You can leave a half a liter to a liter of blood. So that means when you go in, you're leaving with half a liter to a liter of blood less. And that's just for a normal delivery. If you have a complication, it can be more than that. So what does it mean for that's normal? Because your body is changing. Some people have vaginal lacerations. If you have a C-section, you that we are literally cutting into blood vessels. So your body is changing drastically in that moment. It's like running a marathon in a short period of time. Your body literally got hit by a truck and you're recovering afterwards. It is serious. And I think women have superpowers. And for us to get up that next day and have and that is the only like surgery you have where you have the surgery, a major abdominal surgery, and the next day you expected to get up and take care of somebody else. Now tell me about that. I think women are very special. You can't tell me they're not special, okay? And so to be able to do that, to have the strength, your body goes through such a major change. And not to mention, because we don't talk about this,
Mhm.
your self-esteem may change because the appearance of your body looks different after you deliver. Okay. And you're like, I have never, what?
Yeah.
This uterus still looks enlarged. I still look pregnant. What is this? I have stretch marks. I have a new scar. It is different. And what does that mean to you? Because now you physically look different. And that can affect people's emotion and how they show up in the world. And so I think we have to start having more of the real conversations about what pregnancy looks like, what postpartum looks like. People don't talk about that your hormones shift and you might get depressed and go through a period of postpartum depression or psychosis afterwards. These are things that we see, and I think we have to really not just think of it as pregnancy. It comes with a lot. And once I think we realize how special it is to do it, and the next day you see this woman, or the next month you see her looking fabulous, that is amazing. And if she doesn't look fabulous, she's still amazing because a lot her life changed. Her lilife changed.
Wow. I mean, that just opened up my eyes. So I feel like I could do a miniature webinar. I got this, people. I am very good. Like, because again, like you stated, the health is bigger than what one could think of. Because
Mhm.
I mean, you hit on so many points, right? About the health that I didn't even think of.
Mhm.
Now that there's like, oh my God, just a culture base, just
Mhm.
after, it's just so much. And I think we just look at it when they say Black woman maternal health, we just think the baby and the mother, but
Mhm.
not everything around it. Health is so vast and we don't look at it like that, especially, just a citizen, not the actual doctor. Now I'm like, now after this call, I'm just like, oh wow, okay.
I mean, it's a big thing, and it's something that we must fix. But what I'm saying at the crux, we know the statistics, and we've been going over these statistics out loud since COVID, right? So let's forget about the statistics. What are we doing now
Yeah.
to combat these things? What are we learning? What have we learned from all of this? I'm tired of talking about what the problem solutions. I want to talk about, let's talk about these solutions. How are we going to come together as a community and support our moms during such a crucial time in their life, to help them become healthier, and for them to also nurture that next generation.
Yeah. Now, do you think now what would be a solution if you had to place one on the table, like for women after the birth? Like, what would be a great solution that if somebody were to listen and probably say, "Hey, this is a great solution for me," as a physician, what would be a solution you had to place on the table?
Oh, there's so many, because I think you have to attack the problem from more than one angle,
Yeah.
right? So one angle that I can say and advocate is, yes, you should advocate to train more beautiful Black and brown physicians like me that can take care of women, and not just Black women, but we know Black women take care of everybody well. The reports, the research supports it. Okay, if you got a Black doctor, you are going to be taken well. You're going to be taken care of. Okay, like the literature supports it. When we say research, it supports it. So one, creating that pipeline, supporting people and people that are becoming trained to provide medical care for Black and brown people. That's one that I can say from a physician. That is why I'm at Howard University. That is why I am there, to help create that next generation of physicians that will be culturally competent, that will go out there and provide the type of care that we need for our communities. Okay, that's why I'm there. All right, it's not for the pay. Okay.
Yeah.
Um, so the second thing of it is that, I think as a community, we have to start looking at health and pregnancy in a way of not just like we're making new people, because we are, but we have to think of it from a health standpoint. Like, it's almost like you want to create healthy families and healthy children that will go on and continue to make
Yeah.
healthy families and healthy children. And we have to combat and fight some of those generational things that have crept into our health there. So I think as a community, we have to be healthy. We have
Right.
to choose to be healthy. And I know a lot of people are like, yeah, there are a lot of barriers in the way. We are aware of the social determinants of health. We are aware of food deserts where they
Yeah.
don't have fresh food and they don't have walkable living spaces so that they can exercise and be healthy. We are aware. But within that, that's where your community partners and your community, your community leaders and your politics. That's where they come in and they start advocating for those things that we need to have healthy communities. And that's where the community part comes in. And
Yeah.
oh yes, from a bigger standpoint and a legislative standpoint, yes, we do need to have those policymakers and
Yeah.
push for change at a higher level. Yes, we need to fund hospitals that are not funded as well as others. And yes, we need to make sure that people have the type of care that they need so that they can be as healthy as they can. I've been saying this for years. Health is your greatest wealth. You could be the richest person in the world, but if you have poor health, it means nothing, because you will die.
Yeah. Yeah. Yeah.
You will die. And you can health is your greatest wealth. So therefore you must invest in it. You must
Yeah.
invest the time. You must invest the time in the physical component, but also in the mental part
Mm.
of it as well. And you have to find out like, what are you know, my negative relationships with health, or
Mhm.
the thing that is causing me to be unhealthy.
Right. Right.
And we need to address those things as well. So I think we need to, as a community, really have a better strategic plan, because I will tell you, I mean, the disparities are the things that get me. It's not that the medical conditions associated with it, the disparities to me are what's associated with the social and political and unjust.
Right. Right.
That's the part that I think it everybody can be sick, but if the same people have the same sickness and the same illness, why
Yeah.
is one group doing better at it than other? That's
Mm,
where we need to get into the policies and make sure that there is equity in
yeah.
how we provide care for those patients. So
Mm,
I think from a personal standpoint, if I'm a person,
yeah.
if I want to own it as a person, not as a physician, I would own my health.
Yeah.
I'm responsible for my health, not my doctor, not anybody else. So that
Right.
means I need to make the right decisions to be the healthiest I can be before I move forward into whatever it is you choose to do. And I think that's the part is that we think that health is going to fall on us and then we can continue poor habits and get better results. That's not the case. Like
Yeah.
for anything that we want and we work hard for, if you want to learn how, I'm going to use this because I used to play sports to be,
Hmm.
if you want to sink that 3 pointer, you're gonna practice. You're
Yeah.
gonna do whatever it takes for you to be able to hit that game winning shot. And for
Yeah.
me, if I want to be the healthiest at what I'm gonna do, that means every day I have to make decisions that are gonna make me healthier. You know what
Yeah.
I mean? And yes, that make means that it is difficult. That
Yeah.
means I may have to learn some new things. I may have to try some new things. And yeah, I don't like running, but
Mhm.
maybe I like dancing Zumba, or maybe I like, taking a walk with my friends or hula hooping or double dutching. Well, then that's what I'm going to do to
Yeah.
help me be healthier. I know some people don't like running. I personally love running. Some people don't like riding a bike. I love riding a bike.
Mhm.
But I cannot do a Zumba class to save my life. Okay. I will fall over the thing. Okay. Everybody has their thing. And this
Right.
is just not for me. Okay. It's not for me. You're not going to see
Yeah.
sis there. Okay. I would rather just work out and call it a day. Just let me go run a little bit and call it a day. So I think the one thing that we can do on a personal level is own our health, ask questions, advocate for ourselves, and try to move ourselves into that healthful space.
Mm. But Dr. Mitchell, you said a mouthful. You have me over here thinking like, okay, I'm not pregnant, but making sure I'm taking my exercise. Yes, Lord. She spoke to me. I hear you. Yes, I heard you loud and clear. Get up. Because I'm a morning person. I get up. But
Um,
yeah, continue. Don't let it get you. So you spoke to me. You
yes,
definitely spoke to me. So I'm like, I receive it, Lord. I receive
yes.
it. So in the midst of, I know your job has its highs and lows, and it's never a dull moment. I'm pretty much sure. But what keeps Dr. Mitchell going? What the prayer, affirmation, her family? What keeps her going and making her whole just to continue to do the love that she's doing?
I would have to say the one thing or the thing that keeps me going every day when I wake up is probably my patients, my residents, and my students. Like I just got to hug on one of my patients today who was very ill. And
Mhm.
she was so happy to see me on the outside in the clinic that she was just like, I'm grateful because I'm healthy because of you. I'm here. And
Yeah.
this is one of my patients. I'm not going to say too much about her medical
Right.
um, history, but she was not well. And like she saw me today and I just gave her the biggest hug and she gave me, because she just kept saying, it's because of you that I am healthy. And because, we can all be a little stubborn. She was one of those stubborn patients that didn't want to listen. And I was like, no, no, no. Sometimes you got to be like that with somebody, be like, no, 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 that's not what we do. And
Right.
finally she got it. And I think she felt like, oh, this doctor cares enough about me to tell me. Now that don't make no sense
Yeah.
now. And that's what I had to do. And I'm like, so no, this is not what we're gonna do. This is what we are gonna do. And
Right.
not in a way where it was demeaning, but it was in a way of, okay, you want to get to point A, I want to help you get to point A. And
Mhm.
this is what we need to do to get there.
Mhm.
And what you were doing before that didn't help you. Okay. And so I need you to show up, come to your appointments, and we're going to get you there. And when she saw me today, when I tell you, she was just so excited. And she's just like, I'm coming back. I'll see you in 2 weeks. You know what I mean? And that warmed my heart because that is the reason why I'm there. Because when you can make a difference in somebody's life and let them know that you care about their well-being at the end of the day, that is what matters to me. That's what keeps me going. That's what keeps me waking up every day. That's why I do what I do.
I commend you. Thank you.
Yeah,
Thank
no
you.
problem.
Thank you. 'Cause with the state of our country, and we need physicians like you. So thank you. Thank you. I am truly blessed to have you on. I was at awe, and I know, of course, the listeners are going to be at awe just to know there's plethora of information that was shared, and that was just a tip. It's
Oh,
not
that's a tip. Now we can get into the nitty gritty
great. Yeah.
details of, should I be eating this? Should I be doing this? Do I check my blood sugars here or there? We can talk about separate medical conditions, whether that's in pregnancy or not, because I don't know if I shared with you, I was a registered dietitian before I became a physician. So because of that, I'm really into like food and nutrition and total health as well. But also I know the medicine part too. So I can dibble and dabble on both ends. So anytime you need me to be here, I can be technical, or we can sit down and have a good old conversation.
Yes, we probably need to do a part two about that because it gets deep, right? And people really, when they hear from an actual physician, instead of just listen to infomercial or seeing here, knowing that this is an actual doctor, it's
Yeah.
always great just to hear the information and knowing how can I utilize it for myself.
Yeah.
Because like you say, the health is wealth and you need to put you first and the health must come first. So
Yeah.
of course, just sharing what we put in, and it just gets very deep, people. I just want you all to understand this. I was at all, so I know you're at all. And I'm just sitting here like, wow. Okay.
Thank you so much.
Thank you
As
so
I
much.
told you, I was like, sometimes I think the approach that I'm going to take is probably not the normal, like, oh no, we got to do X, Y, and Z and this. But I think if we get at that
Yeah.
core things, everything else will bloom.
Yeah.
That is it. I read a good quote, and then somebody said, I asked a gardener who had a flourishing garden what he did. Like, what did he do to make his garden grow? And the gardener said, I just removed the things that prevented it from growing. That's it. I want to remove those blocks and
Yeah.
those misunderstandings, those misconceptions, those knowledge deficits. I want to fill them, and I'm going to let you do all the growing.
Yeah.
Mhm.
Wow. Wow. See, it gets deep, people. It can get even deeper. This is just a tip. Prayfully, we'll have a part two so that
Okay.
we can get very deep into certain things so that you all will hear. But her information is here. So please reach out to Dr. Mitchell. So great to have you. Thank you so much again, Dr. Mitchell. Thank you, thank you, thank you for being on Coffee with Joy. Thank you. So please make sure that you like, subscribe, and follow Coffee with Joy. For Dr. Mitchell have shared so much. I'm still at awe. I'm still at all. Please do leave your comments below. I know Dr. Mitchell will surely see and will love to hear. And her information is below. We'll put her information below if you would like to reach out. And if you are pregnant or thinking about pregnancy, please make sure you reach out because, hey, health is wealth. You come first. And it just gets deep. It just gets even better. So please make sure that if you would like to patronize our company, please make sure that you follow the QR codes that's on the screen. And if always, if it's a weekday or a weekend, it is Coffee with Joy. Until then, you all live life on purpose and see you all soon.